Hello everyone. Welcome to the recording of our 257 Health EC-12 Framework Overview and CRI Deep Dive webinar. We are excited to kick off capacity building for this exam and provide this recording of information shared from the live webinar from Tuesday, July 2nd, 2024. My name is Kelly Torrey, and I'm a test development specialist on the Educator Standards and Testing team. And alongside the other folks on the Educator Standards and Certification team, we are so excited to kick off capacity building for a slate of exams launching in 2024. As we move through this recording of the webinar, a couple of norms to keep in mind. Remember to invite all perspectives to the table, lean into the stickiness of the work, ask all the questions, anticipate change, and expect non-closure. Let it sit. And for those folks that were able to join us in person, you'll remember that there was a reminder to please ensure that you remained on mute for the duration of the whole group portion. In terms of our objectives for this session, participants will explore the framework for the updated health pedagogy exam, engage with a framework crosswalk for updated exam to highlight key similarities and differences. We'll closely examine examples of constructed response items on the redesigned exam and engage with suggested approaches for candidate response. And then for those folks that were able to join in person, we did have an objective around engaging in an unconference to discuss with EPP colleagues information that was shared in the webinar and potentially determine next steps for programmatic updates based on the new exam framework. An agenda for our time. So we will begin by going through the agenda, objective, review, and norms. We'll share some general information about the redesigned health exam. We'll then spend some time in the 257 Health Framework Overview and Crosswalk. We'll pause to provide some guiding questions for an independent reflection. We'll then transition to a CRI general information overview, and then the deep dive with suggested responses and sample CRI responses. And then there will be a quick reminder before we close out. So to begin with some general exam redesign information, we'll take a look at a redesign exam timeline. So development began of the redesigned Health EC-12 exam in 2021 and has continued for the past few years. This spring of 2024, the preparation manual became available for the 257 health exam. This summer 2024, the representative form and the interactive practice test became available. Looking ahead, our exam launches in September of 2024, and we are here in summer 2024 capacity building. As a reminder, there is stakeholder engagement throughout both the framework development for this redesigned exam as well as item development, and marker selection and standard setting are also done by the field. Coming from our one-pagers, there are a few key dates to call out for our redesigned health exam. Again, this spring, the preparation manual for the 257 exam became available. Registration opened for our 257 health exam as of June 4th, 2024. Beginning on July 1st, the representative exam and the interactive practice test were available. The last date to take the older 157 Health EC-12 exam is September 1st, 2024. September 2nd of 2024, the 257 Health EC-12 exam launches. And then looking ahead to next year, September 1st, 2025 is the last day to apply and recommend a candidate using a score on the 157 health exam. A few important notes. The 257 exam is not representative of a new certification area. The name of the certification area remains the same, and the only change is the exam number from 157 to 257. Programs will not have to reapply to offer this certification. In terms of exam structure, on the older 157 exam, candidates had a 5-hour seat time to complete 100 multiple choice questions. As we look ahead to the 257 redesign exam structure, candidates will answer 90 selected response or multiple choice questions. Within those 90 multiple choice questions will also be a number of cluster items, so multiple choice questions that are related to each other. And then candidates will need to complete one constructed response item on their redesign 257 exam. A quick note, the 257 health exam also has a 5-hour seat time for candidates. Quick check-in on our agenda, and we are moving ahead to framework overview and crosswalk deep dive. As we are reviewing information from the 257 and 157 health frameworks, here are a few key questions to keep in mind. What key similarities do you notice between the 157 and updated 257 frameworks? Where do you notice shifts in the organization or content of the 257 health framework? How might these shifts impact your program's preparation of health candidates? And what other questions do you have about the updated 257 Health EC-12 framework? A quick note on vocabulary. Our 257 Health framework is organized into domains, competencies, and descriptive statements. That domain is the organized collection of knowledge, skills, and abilities that serve as the foundation for the exam. Within each domain, we have competencies that examine what teacher candidates should be able to do within each domain. And then each competency has a number of descriptive statements that provide examples of how teacher candidates can demonstrate their understanding of each competency. The 257 Health EC-12 framework is organized into 5 domains. Domain 1 is health promotion and risk reduction. Domain 2, health-related skills and health resources. Domain 3 is the school health education program. Domain 4 is educating all learners and professional practice. And Domain 5 is a constructed response domain. In just a second, we'll take a closer look at the content of each of these domains. To hold the 157 and 257 framework side by side, our 157 health framework, the older exam, was organized into 5 domains and 15 competencies, while the 257 health framework is organized into 5 domains and 13 competencies. Domain 1, health promotion and risk reduction, contains 4 separate competencies: body systems and health-related factors, mental and emotional health, safety and injury prevention, and prevention of alcohol, tobacco, vape products, and other drug use. Within Domain 2, health-related skills and health resources, we have 3 competencies: interpersonal, social, and family relationships, injury prevention and safety, and personal health efficacy skills. Within Domain 3, the school health education program, 2 competencies, health literacy and health education program. Within Domain 4, educating all learners and professional practice, we have 3 competencies: differentiation strategies in planning and practice, culturally responsive practices, and data-driven practice and formal and informal assessment. A quick note, as in all redesigned exams, Domain 4, educating all learners in professional practice, is the universal domain. And then finally, Domain 5, constructed response, has 1 competency, which is the CRI, constructed response item. Again, a quick note, constructed response items are present in all redesigned exams alongside the universal domain. We'll now take a look at the organization of previous exam framework information within the 257 health framework. So within competency 1 on our new 257 exam, we do have information from 157 comps 1, 2, and 3. Comp 2 does contain information from 157 comp 4. Competency 3 does have information from 157 comps 1 and 7. And then competency 4 does contain information from 157 comp 9. Moving into domain 2, competency 5 has information from 157 comps 5 and 6. Competency 6 has information from 157 comp 8. And competency 7 has information from 157 comp 6, 10, 11, and 14. As we move into domain 3, competency 8 has information from 157 comps 12 and 13. Competency 9 has information from competencies 14 and 15 on the 157 exam. And the highlighted information represents new content from both our universal domain and the constructed response item. As part of a package of resources moving alongside the launch of the 257 exam, a framework crosswalk has also been completed for your reference. On the left-hand side, you can see information from the 257 Health EC-12 exam framework, both the domains, competencies, and descriptive statements. On the right-hand side, you'll see an indicator showing whether or not there was parallel content from the 157 exam, and then the descriptive statements that are most aligned to the new content on the 257 exam. Any content that is highlighted on this exam crosswalk does not have an exact parallel and should be considered new information on the 257 health crosswalk. We'll now take a look at each competency and take a moment to highlight what is new within the exam framework, as well as the reorganization of content and similar themes throughout the framework. Within competency 1, again, we do have similar content from the older exam from competencies 1, 2, and 3, but there is an additional call out here in the addition of personal care and hygiene content that is new on the 257 health exam. Within competency 2, we have information from the 157 exam comp 4, with the addition of self-esteem and self-concept content, as well as the promotion of student self-regulation skills. Within Comp 3, we have content from the 157 exam competencies 1 and 7, as well as the addition of knowledge of reproductive and sexual health concepts and consequences related to teen pregnancy. Within Comp 4, we have content from 157 Comp 9, as well as the addition of consequences related to alcohol, tobacco, and drug use. Within Comp 5, we have content from 157's Comp 5 and 6, as well as the addition of influence of positive and negative communication behaviors and supportive and nurturing environments. Within Competency 6, we have information from 157 Comp 8, as well as the addition of digital citizenship, online bullying, safe and unsafe online interactions, as well as emergency procedures, mandatory reporting responsibilities, and self-harm suicidal ideation policies. Within Comp 7, we have content from 157 Comp 6, 10, 11, and 14, as well as the addition of personal health strengths and student self-management techniques. Within Comp 8, we have content from 157 Comps 12 and 13, as well as the addition of concepts and principles related to health literacy, impact of media, and marketing. Within Competency 9, we have content from 157 Comps 14 and 15, as well as the addition of whole school, whole community, whole child model, national and state data for planning purposes, assessment data, professional responsibilities, and text-based instruction. In terms of the universal domain, this new domain includes practices that inform supports for all learners. Here's where we'll see the inclusion of UDL practices, data-driven assessment, and application of health-related skills that make up our educating all learners and professional practice domain. In terms of the overall organization of the exam and framework, here you can see each domain as well as the approximate percentage of the exam that they make up. Domain 1, health and wellness, is approximately 22% of the exam. Domain 2, health skills for reducing risks, is approximately 30% of the exam. Domain 3, health literacy and health education, makes up approximately 14% of the exam. Domain 4, the universal domain, educating all learners and professional practice, makes up approximately 13% of the exam. And then Domain 5, the constructed response, makes up approximately 20% of the exam. As you review this information, here are a few questions to consider. What are some priorities you can see in having the exam weighted in this way? Ultimately, what does this mean for candidates? And where can you see differences or shifted priorities from the previous 157 exam? We'll now take a moment to revisit our guiding questions as we've completed our framework overview. Now that we have reviewed this information, what key similarities do you notice between the 157 and 257 frameworks? Where do you notice shifts in the organization or content of the 257 framework? How might these shifts impact your program's preparation of health candidates? And what other questions do you have about the updated 257 framework? Here's a look at our agenda, and we'll now transition to reviewing CRI general information and our CRI deep dive. We'll now do a brief overview of the constructed response item. The constructed response item is an opportunity for candidates to demonstrate their subject-specific knowledge, skills, concepts, and best practices. Candidates should be prepared to write a response approximately 400 to 600 words long. And the constructed response item does make up 20% of a candidate's overall exam score. There are 3 performance characteristics that are used to create rubrics to score candidate CRI responses. 3 performance characteristics are completion, the degree to which the candidate completes the assignment by responding to each specific task in the assignment. Application of content, the degree to which the candidate applies the relevant knowledge and skills to the response accurately and effectively. And support, the degree to which the candidate supports the response with appropriate evidence, examples, and explanations based on relevant content, knowledge, and skills. Constructed response items are scored on a scale of 4 to 1, with 4 being the highest. A 4 response reflects a thorough understanding of the relevant content, knowledge, and skills. A 4 response fully addresses all parts of the assignment, demonstrates an accurate, highly effective application of relevant content, knowledge, and skills, and provides strong, relevant evidence, specific examples, and well-reasoned explanations. A 3 response reflects a general understanding of the relevant content, knowledge, and skills. A 3 response addresses most or all parts of the assignment, demonstrates a generally accurate, effective application of the relevant content, knowledge, and skills, and provides sufficient evidence, some examples, and generally sound explanations. A 2 response reflects a limited understanding of relevant content, knowledge, and skills. The response addresses at least some parts of the assignment, demonstrates a partially accurate, partially effective application of the relevant content, knowledge, and skills, and provides limited evidence and examples or explanations, when provided, may be only partially appropriate. A 1 response reflects little or no understanding of relevant content, knowledge, and skills. A 1 response addresses few, if any, parts of the assignment, demonstrates a largely inaccurate, ineffective application of relevant content, knowledge, and skills, and provides little to no evidence, and if provided, examples or explanations are weak or inappropriate. Candidates can also receive a score of a U. This response would mean that it is unscorable because it is unreadable, not written to the assigned topic, written in a language other than English, or does not contain a sufficient amount of original work to score. Candidates can also receive a score of B when there is no response to the assignment. We'll now take a closer look at the 257 Health EC-12 constructed response item. The Health 257 EC-12 CRI charge contains 5 specific tasks. 1. Identify a learning objective that is aligned with the given TEAC standards and explain why the learning objective is appropriate for a 7th grade health education class. In this example, the TEAC provided is a 7th grade health education TEAC. Candidates will also describe 1 instructional activity, including teaching strategies, that you would use to promote student achievement of the learning objective that you identified. Explain why the activity you described would be effective for promoting students' health, knowledge, and skills in relation to the learning objective. Explain how and why you would differentiate instruction or modify the activity to maximize learning opportunities for students. And 5, describe 1 approach for assessing student skill development or conceptual understanding in relation to the learning objective and instructional activity. Candidates are also provided an exhibit within their health CRI. The exhibit is going to provide the specific TEAC a candidate is required to utilize throughout their constructed response. Again, in the example we'll look at today, we are engaging with a 7th grade health TEAC. Using that TEAC, again, candidates have 5 specific tasks within their charge that they need to address within their written response. Take a moment to review the sample constructed response item. Then consider the following. Where do you see evidence of the candidate's understanding of health-related knowledge, skills, and/or related concepts? Does this response answer each component of the CRI charge in full? And does the sample response contain accurate evidence or examples to support their instructional strategy? We'll now take a moment to examine a strong candidate response. You can see here that the candidate very clearly identifies a learning objective based on the 7th grade TEAC they're provided, as well as providing an explanation as to why the learning objective is appropriate. Second, the candidate provides a thorough description of the instructional strategy they would use to promote student learning towards their given learning objective. Next, the candidate explains why that instructional activity would be effective for promoting students' knowledge in relation to the learning objective, as well as provides a description of appropriate differentiation strategies to promote the learning of all students. Finally, the candidate provides an approach for assessing student knowledge, which is the final task within their CRI charge. As we take a look at this candidate response overall, we can see that the candidate fully addresses all parts of the assignment, demonstrates accurate, highly effective application of skills and knowledge, and provides specific examples and strong, well-reasoned explanations. Take a moment to review this second sample candidate response. As you're reviewing, consider the following. Where do you see evidence of the candidate's understanding of health-related knowledge skills and/or related concepts? Does this response answer each component of the CRI charge in full? And does the sample response contain accurate evidence or examples to support their instructional strategy? As we review the first part of the candidate's response, the response does state what students will learn, but does not provide a clear learning objective. In addition, some of the standard is copied into the candidate's response. Next, the response attempts to address why the learning is appropriate, but focuses more on what the school nurse will do rather than describing teacher actions. Within this candidate's response, teaching strategies are not provided, but details of the student task are. Next, the candidate does provide an explanation for why the instructional activity would be effective while only partially addressing a full explanation. Finally, this response hints at why differentiation or modifying instruction is important for all students, but it is missing an explanation for how the differentiation or modification will be done. The candidate also does not describe any specific assessment approach. Overall, this candidate's response provides a limited application of accurate, relevant, effective professional knowledge for teaching health, provides a limited demonstration of pedagogy, provides minimal evidence or explanation, and more support is needed in the candidate's response for how to appropriately differentiate instruction. Take a moment now to review these guiding questions around completion, application of content, and support criteria for constructed response items. For completion, why is it important to answer each specific task within the constructed response item? Where do you anticipate candidates may or may not provide a complete response? With an application of content, how might you support candidates to apply their learning within a constructed response item? And finally, for support, how can you support candidates to leverage appropriate evidence, examples, and explanations within their constructed response item? Thank you so much for participating in the recording of the 257 Health Framework Overview and CRI Deep Dive webinar.